I'm Dr. Manga Reddy, General Physician at Uday Women Hospital. Today, on behalf of International Women's Day, wishing you all the women happy Women's Day. So today I am going to brief about why it is important for women to undergo yearly health checkups. The motto of yearly health checkup is to promote preventive health care. What is preventive health care? How it is important for women? So preventive health care is any type of health care activity that helps prevent the illness or disease. So preventive care health plans includes annual health checkups and health screening tests and immunizations and counseling regarding diet and exercise. Healthcare by doing routine health checkups for detecting diabetes and pre-diabetes and thyroid levels, and also by mounting BMI, body mass index. So we can tell regarding what you have. By routine screening, we will detect some pre-diabetic changes and diabetes and high blood pressure, and for high cholesterol we can treat it and counsel and control it. So thereby we are allowing the secondary complications from the chronic diseases like diabetes and hypertension, which will lead to future problems like in the form of coronary heart disease or stroke or chronic kidney disease if you are not controlled properly those risk factors. So these are the routine blood investigations. And second heading is cancer screenings. The most common cancer screenings in women is, first one is breast cancer screening. For breast cancer screening, we do regularly mammograms. For earlier detection of breast cancer, so we do advise do self breast examination every month at the age of starting at the age of 20 years for any changes in the breast in the form of lumps or discharge from the nipple, or nipple changes in the form of inward pulling of the nipple, that is what we call it as retraction of nipple, and also dimpling of the skin around the areola or nipple. And we do regularly recommend the screening for baseline mammogram at the age of 40 years, and thereafter we advise every second yearly mammograms it should be done. So we do recommend earlier mammograms if you have any family history of breast cancer or any abnormal gene for breast cancer. This is regarding breast cancer. And also second one is the cervical cancer. This is the second most common cancer in women in India. So we initiate screening with cervical cancer with pap smear test. So actually cervical cancer is caused by HPV infection, human papillomavirus infection. So which is caused by serotype 16 and 18, which accounts for 76% of cervical cancer in India. So HPV vaccine is it's a viral infection. So we can prevent it by means of doing vaccination. So there are two types of vaccine available in India. One is quadrivalent vaccine, Gardasil, and second one is bivalent vaccine, what we call it as Cervarix. So it can be given as early as 9 years up to 26 years. So but it should be given before the onset of first sexual activity. And also by regularly we do it pap smears at the age of 20, starting at the age of 21 years, and after that every yearly up to the age of 30 years. After 30 years we do recommend every 5 years for pap smear along with HPV DNA test. We recommend to discontinue if the woman reaches 65 years, or if the 3 pap smear results have been normal in the last 10 years, or if there is no history of risk factor cervical cancer, we advise to recommend the screening test. And what are the risk factors for cervical cancer? There are 6 risk factors for cervical cancer. One is multiple partners, and there is increased number of childbirths and genetic factors. There is history of smoking, or there is history of DES exposure in utero, or history of smoking, and history of OC pills usage, oral contraceptive pills usage. These are risk factors for cervical cancer. And those who have high risk factors, we do advise yearly screening for pap smear for cervical cancer. This is regarding cervical cancer. So, and the third one is regarding routine ultrasound abdomen, whole abdomen, to detect any ovarian neoplasms. And fourth one is osteoporosis. Osteoporosis is weakening of the bone. So it usually occurs post-menopausal women. So we do recommend DEXA scan at the age of 60 years or earlier if the woman has risk factors for osteoporosis. Fifth one is regarding colonic carcinoma. We do regularly advise in women over 50 years of age, or earlier if the woman has familial polyposis or hereditary non-polyposis or colorectal carcinoma or any high risk factors, we do recommend earlier for colorectal carcinoma screening in the form of colonoscopy. Sixth one is, and also we should report to gynecologist if you have any abnormal uterine bleeding, if the irregular periods, if it is less than 21 days or more than 35 days, or intramenstrual spotting, or if there is post-menopausal bleeding. So definitely these people will immediately consult the gynecologist. And dental checkups include oral cancer is the third most common cancer in India. So what are the preventive measures to prevent dental issues is quitting smoking and alcohol, and avoidance of sharp teeth, and tobacco chewing, evidence of tobacco chewing. These are the preventive measures for good oral health. And last one is by doing routine test for detection of diabetes and high blood pressure and also cholesterol. So we'll treat it, then we will prevent the complications from getting chronic disease like diabetes and hypertension and thyroid and obesity. So last one is counseling. Counseling in the form of eating a great good amount of green leafy vegetables and reducing salt for people those who are having hypertension, and pre-diabetic people advising sugar-free diet and promoting millets, and losing weight in the form of promoting physical activity at least 150 minutes per week. It's a must for any people. BMI is more than 25. So we need to follow these measures to promote our health. So prevent health, reduce the cost and treatment options in future. So it is important to go, every woman to go all the annual tests for detection of cancers or routine health checkups. That's why they are important for our health. Thank you.